Nguyen. Let's go in with Dr. Hoa Nguyen here in the KUAM News Zoom room.
Hey
Uh,
guys.
Thank you, Senator. Doc, wow, I don't even know where to start. There's just so much going on. 600, this is a record, 637 positive cases last night. No restrictions, no much of anything. The messaging from the public health authority and the governor has not changed. Go get your shots, right? Go get tested. Your thoughts, Doc. I mean, first of all, we had 600 cases reported over the weekend, attack another 637 onto that. I mean, this surge is it's real.
Yeah, it's real, and we see it's coming already. When this we're not going to be any difference than anywhere in the state. Hawaii have over 6,000 yesterday, and they are about 5 6 weeks into the surge. So we're gonna get higher. And the problem is that the hospital was slowly going up. It's not going to be as bad as the Delta, but with the high number positive, there will be some hospitalization and some people will get affected. But economic wise, boy, I tell you, it's going to hit a lot of business. We even the healthcare center, and the restaurant or the business going to have a lot of people because of positive. So it's not just the health care system that get a burden, but the business will be affected also. In the state, there's a lot of businesses closing a few days just because there's too many positive in the business. So I don't know. We have to do something. Right? People expect it's not a lockdown. It's never going to happen. And it's unreasonable. But I think that restriction of the number of gatherings should be there. Mentally, psychologically, people will abide by that, and they think twice about putting the big gathering together. So I think that something have to happen. If we let the thing go right now, I don't know. We're going to have a long ride here for the next few weeks.
I still can't really wrap my mind around that this is the play. Let's just let it run. It seems it seems pretty reckless, Doc. I mean, we're talking about a 23%, Jay? 23% positivity rate reported yesterday, 637 positives out of I think about 2,300 tests.
2,700.
Oh, 2,700. Thank you, Jay.
2,747 to be exact.
Right. So they're testing a lot of people. But Doc, when you talk about these positives and the large number of positives, of course, some of them are going to end up in the hospital, right?
Yes, that definitely. The majority of the case we see still mild symptom, but again, mixing into those mild symptoms. There's some people that will get in trouble, and we have not get into the elderly yet. Right now, the majority of the people that turn positive is the 18 to 39, but sooner or later, they will bring it home, and that's where we're going to see later on that the elderly will get affected. So like I said, the last three surge, we just let it burn out by itself, and I think this one, the way they go right now, is going to be the same thing. So it's gonna take a long time for us to get out of this thing if we don't do anything different than just promoting boosting and testing. You got to somehow encourage people to kind of curtail the gathering. By doing that, it's just put some restriction. It's not hard to go from 100 down to 50, and I don't think people will fight for that one. But again, it's just let people know that hey, we are trying our best just to kind of slow down this positive rate that we have at this point.
I think it would go a long way to show any kind of effort. Press conferences. I was really surprised that they had a press conference yesterday for all these raises that they're giving out, and they didn't say the C word. I don't even think once. COVID. No, yeah. I felt like it would have been a good opportunity for the governor to say, "Hey, everybody, I know we're celebrating these raises, kicking off the election year in a big way. But also there's the surge thing going on, and I just want to talk to you about that. I mean, wouldn't that have been a great opportunity, Doc? Because I feel like people are just wanting to hear something from their elected leaders.
Yeah, I think that's we have to say something. You know, is that you can't see this number going up all the time. It's even Hawaii are trying to do something different, right? I mean, at this point, people don't like it much, but you know, they are look like they require a booster now for to be complete. You know, so they are trying their best to do that stuff. They have the QR code for the for verification of the vaccine. And so far, you know, well, for us, we haven't done anything different than just promote booster. That we have to do something different on this one, but we cannot go the way we are in the last three surges, especially Delta. We just let it ride, and you can see we lost quite a few people, and we don't be the same right this time. But it's just going to get a bit longer. I don't think February 1st will be over. It's going to be the end of February if we keep going the way we are.
That's what Dr. Hoa is referencing. He's referencing the current PAG chair, Dr. Nathaniel Berg, had said that the surge would be over by February 1st. Well, not sure that's going to
I'm wrong. You know, that's a blessing for our island, but I don't think that for everyone the positive, we have 600 yesterday. There's 2 or 3 more positive in the community that we didn't test. So it's a big picture out there that people have to be careful. And again, you know, our message, our people is, you know, try to really, if the government don't put a restriction, then restrict yourself and try to you know, not have any large gathering, because you don't know who's around you that have the virus. And what we see right now, and from the clinic standpoint of view, when people turn into a clinic and test positive, we really have to kind of get the story out of them that they have some congestion, some throat irritation, or some very mild symptom. But again, it will affect the majority of people. So our people really need to kind of pay attention to what they have. If they don't feel normal, and even you have just a little bit of runny nose or watery eye, no, those are symptoms. Go get tested and not go to work, and protect yourself from your family, because that's how you spread the virus. We have to slow down, like I said, because once you get to the elderly, that's when it affects the hospitalization. So you know, pay attention to your symptom and try, you know, not to go to work if you have symptoms, and go get tested. You know, that's the best part about it, is that don't ignore things that you have just some allergy or some cold virus. Go get tested, you know, so that way you can protect people around you.
Doc, we're talking about testing here. We have a comment. I actually went out to the testing site yesterday just to talk with our people, and what I saw, I talked to like maybe the first 10 cars, a lot of symptomatic patients, a lot of people who had a family member who was sick, and now they were feeling sick, and so they were all going to get tested. But we did have a comment here from Samantha. Took my symptomatic brother to get tested yesterday. No appointment, of course, because you don't know when you're going to get sick. And I was told they were not prioritizing symptomatic people as reported. It's still first come, first serve. I got there at 10 a.m. and was told to come back before 1 p.m. Why are we still going through this 2 years into this pandemic, Doc?
Yeah, you know, for this is the healthcare system. Once you want to limit the amount of tests, you put them in an appointment. When you have a mass testing, again, appointment is not the best way to go. You know, that's how the healthcare system work, right? In the clinic, in order for us to control the number of walk-in, we put appointment. But once if I want to open the clinic really wide and test everybody that's sick visit, I just have walk in, because that's how you get the number of people to come in. And you can prioritize the symptomatic one, because that's the one you really want to get tested to make sure they don't have the virus. So appointment is a way to control the number of people coming in. And, I think in the middle of the surge right now, what they should do is open more sites and just walk in and prioritize the symptomatic patient and test them first. And, and also educate the public, right? I mean, the day that you get tested is very important for the close contact. If you have a close contact just yesterday to get tested today and it's negative, it didn't mean anything. Again, if you have a close contact, just watch your symptom. You can go to work, you can do stuff, but it takes about anywhere from 3 to 5 days for you to become symptomatic if you have the virus. So the best time to test for close contact is anywhere from day number 3 to number 5. So don't get tested if you get notified that you close contact yesterday, because if you test negative, you can still come down as a positive about 3-4 days from now. So, that's something we need to kind of educate the public, so that way you don't have a lot of people test negative because of close contact, and then a few days later they become sick again, and then now they think they're negative. So that's something that education-wise we have to do that, and again prioritize the people that have symptoms. I will put a person at the beginning at the gate and ask them if they have symptom or not. If they have symptom, go to a different line. Triage them at the beginning. And that's you will most likely use your testing capacity at the maximum efficiency at that point.
Doc, we had a couple of comments here. Clarissa, just seeking clarification, really. Do we need an appointment or no? Both my kids out of school for 2 days and they need to be tested. And yeah, we get the appointment stuff. I really do. You're trying to make it, but it's a fast pivot, right? I mean, you could be fine today, tomorrow, oh, 2 kids sick, got to go get tested or whatever, right? And they don't have, I mean, I don't even know if they have any appointments left. Jake, could you check?
Yeah, it's hard to make an appointment because if you have a 8 o'clock appointment, you have 20 cars in front of you, and you're gonna be late. It's very hard to do that for testing.
Doc, when you're talking about what's happening in the States with shortages, we're seeing that here already. I know that we're supposed to do a shoot, and a restaurant just short-staffed because everyone is either positive or isolating because of a close contact, right? And so this restaurant closed early yesterday. I don't think they're going to open today. We're seeing other businesses that are sending out notices that they're just closing up because they don't have enough staff to run things. I'm seeing this in Saipan too. A friend of mine owns a restaurant in Saipan. They had a bunch of exposures, some positive. They just shut down, totally just closed.
Yes, it's going to affect a lot the restaurant, the business, the construction. It's going to affect everyone if we don't put some control on this thing. It's just again, fortunately, a lot of people won't end up in the hospital, but again, it's disrupt the business just because the employee have to stay home.
Right.
Yeah, so Chris, I'm sorry, you were asking the question, Chris, about about if there are availabilities. The T's inside, I'm on the site right now, so tinyurl.com/COVID stops with me. Today and Thursday, fully booked, sold out already.
Wow.
Yeah.
Friday and Saturday still available though.
Oh yeah. So
it's sold out like that. You got to thinking, hey, you got to open another site somewhere.
I mean, this was sold out last week, Doc. So I don't know, like, why are they being so hard-headed?
I think I think the true reason is there's the manpower issue. They are short. You can't do so much with so many people, and that's why it's important to do the testing the most efficient way. If you want to catch this, prioritize the symptomatic patient. But that means that you have to put a person at the beginning of the line,
right? Yeah.
When you in.
Yeah. And they have a person at the beginning of the line, Doc. But what I found was yesterday when I was making my way down the line, I mean there were 12 cars, 13 cars down. People were symptomatic, and so
yeah. I'm about when you first entered
right,
the That's
But
where the beginning of the line.
and you know what's frustrating, Doc, is these people have no clue what's going on. They don't, and we're doing our part. We're telling you it's appointment. We're telling you it's fully booked. We're telling you what to do. But these people in the line, I mean, they were like, "Oh, Chris, so we're symptomatic. Can we just drive up?" I'm like, "Well, they said they were giving priority to symptomatic, but I don't know. I mean." And they don't want to lose their place in line. So yeah, it's so frustrating, Doc, to see our people.
Yeah.
And that's what gets me. It's like I don't like it when our people are feeling a certain way and they don't have to. Right? They don't have to be feeling this way. If there was more information coming out, if there was more of a presence, then maybe it would just kind of like ease some of these concerns that they have. Very real and valid concerns.
Yeah, there has other place. I know the public health place are testing, GRC are testing. I think all the tier 2 are testing at certain capacity because we have other patients that we have to take care of. But again, I think it will be much benefit if you have a central drive-in testing site somewhere in the central or south. That's with no appointment. You got to spread out the load of teaching. There's a lot. I saw a line of car there when I passed by, and that's about 7 o'clock, and they don't test till 8. So it's just a long way to wait.
Yeah, interesting point, because Doc is actually talking about like decentralizing it. As far as the vaccinations clinic go up in Dedido, at the Northern Regional Community Health Center, and again, this is for vaccinations, not testing. But today, tomorrow, and Friday and Saturday still available down in Inalahan again for vaccinations, not testing.
Are they doing testing at Southern Public Health? We did have a comment that they were, but I know they don't do. Usually, they don't do vaccine testing in the same location. But I think Southern Public Health tests on certain days. I want to say, right, Jay? He'll get into that.
Yeah.
Doc, so can we just, for the record, if you were still the PAG chair, what would your recommendations be to Governor Lulian Guerrero this morning?
I think they should put some restriction out there. Like I say, put from 100 down to 50. And I think again psychologically, people will say, hey, there's some restriction there. Maybe I wouldn't do any gathering, any planning for party. Right now, because there's no restriction in the people's mind after 2 years in pandemic. If you don't have a restriction there, they say, hey, we can do whatever we want. And that's what keep the number positive up all the time. And to me, people out there, they expect some restriction just to get to some guideline. I don't think they're going to argue, say, hey, you cut down the number from 100 down to 50. They're going to argue much about it because they know, and that's the thing. So we got to do something different than just boosting and testing. It's not working. So we got to do something different.
Doc, can we just get a comment from you on the hospitalizations? Can I see, Jay, the data of the hospitalizations, the vaxxed, the unvaxxed? So it is 18 vaccinated, 6 unvaxxed. One ineligible was a 2-year-old child friend of mine. Their kid was hospitalized with COVID, and one was unknown because Naval Hospital didn't tell public health the status. But people are keying in on this 3-to-1 rate of hospitalizations, vaccinated versus unvaxxed.
You're going to have a lot more vaccination patient in the hospital, and that's going to be it's not going to be just now, it's going to be the rest of the pandemic. You have a large number of vaccination patients out there that are fully vaccinated but not boosted. You have right now about 30% of our fully vaccinated that not that boosted. So that mean that the rest of the 70% of the people that are fully vaccinated, they're not fully protected. So and when you have unrestricted gathering, the vaccinated people that are not fully protected, they will end up in the hospital because they, just like anyone else, their immunities are coming down, and their chance to be in the hospital is higher. Again, the number will be higher because there's a large percentage of fully vaccinated but not fully protected people out there. So that's the reason why. it's not that the vaccine doesn't work. It's just that your immunity level at a much lower level now that because you're not boosted, and if you go to gathering and you put your mask down, yeah, you'll be in the hospital, and that's why we see that. Not because the vaccination don't work, just because our boost percent so low.
Thank you for that, Doc. Appreciate that, because I know a lot of people will look at that and they'll say, "Well, why bother getting the vaccine?" So thank you. I know that we talked about the booster because you're talking about fully vaccinated people who aren't fully protected because they haven't got the third shot. Do we need to ramp up the efforts? I'm waiting on the jingle. I'm waiting on the public health. You know, it's not like how it used to go out and get your boost. You know what I mean? Got to work with us here, people.
Yeah, that's we have to put the message out there, right? Because like you say, people say, "Hey, why we vaccinate?" and you end up in the hospital, and they have to understand the reason why, and the reason is because a lot of people turn positive that we see that had the second shot more than 6 months ago, and that's something that we have to let people know that, hey, don't look at the hospital, see how many vaccinated people versus unvaxxed, just because most likely those people are fully vaxxed but way off of their booster already. So that's the reason why, and you have to put that message out there so that people understand, and they will try to go protect themselves by getting the booster.
Thank you, Doc.
Okay. So again, Christian, ask everyone, try the best. Even we don't have restriction. If you plan any gathering, be responsible and try to cut down the number of guests that you invited, and make sure that somehow use your mask around other people. We have a mask mandate, but the problem during the gathering, there's no such thing as mask mandate. Everyone dropped their mask, and that's where the exposure and the spread coming from. So try to limit yourself if the government don't put any restriction out there, and be responsible to your guests.
Just one more time, Doc. Marcy comments in here, and maybe just correct me if I'm wrong. I'll try and explain it in a way that she can understand. She's saying your answer still doesn't explain why the hospitalization of unvaccinated is less. So what you're basically saying is because we have 90 million people on Guam who are vaccinated, that doesn't necessarily mean they're fully protected because they haven't got the booster. So if you got the vaccine more than 6 months ago, they say the effectiveness of it is rapidly declining, and so you're exposed, okay? And so with more people who are fully vaccinated, they're going to represent a larger percentage of the hospitalizations because there are only about 10,000 unvaccinated people on the island.
Yeah.
That's what you're saying.
You are correct. We will have 130,000 people that fully vaccinated, something like that, and you have about 40,000 that boosted. So you are kind of short quite a bit. So
I'm not short, Doc. I'm boosted. I'm right where as long as I need to be. Boosted up.
A lot of people out there is not fully protected, so that's the reason why. And again, it's just a pure number thing, and you will see a lot more vaccinated people in the hospital because they're not boosted. That's not because the vaccination doesn't work. So if I were them, if people are fully vaccinated, go out there and get your boosters, so that way the chance to end up in the hospital is much, much less.
Thank you, Doc.
You're welcome, guys. And again, try to count the day that you have a close contact, and try the most effective day for close contact for testing, day number 3 to number 5, and just watch the symptom, okay?
Doc, can you, so I'm sorry, we're way over, but just real quick, the definition of close contact, in your opinion, does it need to be changed because Omicron is way more contagious? Because the definition that they're using, it's kind of like Delta Alpha.
I don't know, the Omicron is so infectious, you drop your mask for a few minutes around somebody that have the virus, you will catch the virus. The chance is very high. So forget about the rule. Just wear your mask around people that you don't know, so that way you protect yourself.
Thank you, Doc.
You're welcome. Be safe, and let's all hope that this surge will end soon. But I think it's going to be probably the end of February, the way we go right now.
Or they could just keep making it harder for people to get tested, and we'll just be done with this next week. Thanks,
just
Doc.
be careful.
Okay.
You're welcome.
Right
Take
on.
care, guys.
Right on. Be safe. We got all of our shots. I'm wearing 2 masks. Jason's got his N90 million. What is that?
And KN95.
KN95.
I had to spend a few bucks on
That's
that.
the thing, dude. This new guidance. Do we have that video? We should get that one we posted on the.
Oh, okay.
I'll talk to you. Okay. Basically, the new mask guidance is whatever mask you have is not good enough. Go spend your money on a new one. How much are those, Jay?
I got a pack of